Dr. Maya Nye with people concerned about chemical safety and environmental justice organization in Kanawha Valley, West Virginia, and we are dedicated to protecting the health and safety of all who live, work, and study near hazardous chemical facilities. We formed in 1984, partially because MIC, the same chemical involved in the Bhopal disaster, was stockpiled in our backyard in the predominantly Black community of Institute, West Virginia, in near 4 times the amount of what was released in Bhopal. I grew up and went to school about a mile away from the Institute facility. Many of my neighbors and mentors, they're not here today because they've either died or are sick, or to be painfully honest, they're really tired of trying to convince the EPA and federal government to protect them. When I was a kid, I was sitting in my living room when I heard and felt an explosion at the Institute facility. I sheltered in place like I was taught in school, but the chemicals still invaded my house. 2 workers died. My life was forever changed. Even though proven inherently safer technologies existed and every other US company manufacturing MIC transitioned away from it after Bhopal, my community continued to stockpile it for more than 25 years. Why? Because implementing these inherently safer technologies was not required, and it's still not required under the proposed rule. On August 28, 2008, sitting in my living room, I heard and felt an explosion in Institute at then Bayer Crop Science, member of an American Chemistry Council's voluntary responsible care program. It nearly eclipsed another Bhopal disaster and once again traumatized our community just like it did 15 years previously. Once again, 2 workers died. At the historically Black university on the fence line, at least 1 student died, but his death isn't accounted for in your accident database. Nor is the 2008 Bayer disaster, which you reference many times in the proposed rule, including when you point to the Chemical Safety Board conclusions that inherently safer technologies would have prevented the incident. How many more incidents must there be before you require inherently safer chemicals and processes? How many other incidents are missing from the data that aren't accounted for in the regulatory impact analysis? The cost to taxpayers for the Chemical Safety Board investigation? How about the $75 million spent by the companies to upgrade the inherently dangerous processes after these disasters? Those aren't considered. The cumulative impacts, the social consequences, the intergenerational trauma that result from these disasters are not addressed. In closing, voluntary measures don't work. We need prevention requirements now. Thank you very much.
Thank you, Maya. Next, we have Deirdre Nelms from Coming Clean. Deirdre?